Good afternoon. This Friday, the 17th, will mark 1 month that our state has been sheltering in place per Governor Pritzker's executive order. You'll hear different analogies opining on whether this was a good idea or not, but by looking at the science behind the order, it's had a strong impact to curtail the exponential growth of the coronavirus. Although there is plenty of discussion going on about the appropriate time to begin to restart our city, our state, and our national economic engines, I am encouraged that those discussions are beginning to happen as that light at the end of the tunnel is getting just a little bit brighter every day. It's very important that we all understand a couple of important points. Thanks in large part to the isolating techniques that have been employed, it looks like we're having success in flattening the coronavirus curve. Instead of growing to an apex and then declining over an extended period, hopefully we'll hit a plateau that will gradually shrink if we continue to employ the safety measures. We all hope that time comes soon. What we must stay focused on is maintaining these safety measures and curtailing the spread of the virus. Please don't stop now. We've made too much progress. We're looking for widespread testing and contact tracing to give our health professionals solid metrics to determine where we really are in this fight against COVID-19 and what areas that we need to put a stronger focus on. We must do everything in our power to continue to protect those on the front line of this medical crusade. Again, we are so fortunate to have such an extraordinary healthcare complex, and our thanks go out to all of those working in that capacity. Discussions are starting to prepare our communities to hit the ground running when the restrictions begin to lift. We know that the most important thing that we can do is to get business back open and put people back to work. But we have to be exceedingly safe as we do that. But when the time comes, we will be ready as a unified community to get our economic train back on track. And along with Peoria County Board Chairman Andrew Rand, Tazewell County Board Chairman Dave Zimmerman, and Woodford County's Chairman John Krug, we all appreciate everyone's continued help and assistance as we work hard to give our community as much information as we can relating to the COVID situation. And now, Monica Hendrickson.
Thank you, Mayor Artis. Good afternoon, and thank you for joining us for today's COVID-19 briefing. I'll begin with the to-date totals as of April 15th. The Tri-County region has 65 cases to date. Peoria County is reporting 33 cases. Tazewell County reporting 21 cases, and Woodford County reporting 11 cases. The total number of deaths remain at 4. The hospital systems of OSF St. Francis Medical Center, Union Point Health, Methodist, Pekin, and Proctor report currently 21 ICU beds in use, 15 for persons under investigation, and 6 for those confirmed cases. In addition, there are 28 non-ICU beds in use for either confirmed or persons under an investigation. For Peoria County specifically, of the 33 confirmed cases, 12 are recovering, 16 are at home self-isolating, 4 are hospitalized, and 1 is deceased. In regards to our demographics, while we have cases between the ages of 20 to 99, the greatest number of cases can be found amongst 30 to 39-year-olds, 50 to 59-year-olds, and 60 to 69-year-olds. Highlighting the fact that this virus can impact multiple individuals of various backgrounds and age ranges. In terms of demographics, 64% are females of our confirmed cases, and the racial demographics, whites make up 61% of our cases, and Black or African Americans make up 27% of our cases. Yesterday, Dr. Nyala spoke on the importance of understanding your health status amongst all groups of people and understanding our risk in terms of COVID-19. Today, to continue this conversation, is Pastor Marvin Hightower, President of the NAACP.
Good afternoon. I first would like to thank Mayor Artis and Dr. Hendrickson for this opportunity to address some of my concerns regarding COVID-19 and the African American community here in Peoria. The Bible says in Ecclesiastes chapter 3, verse 1, to everything there is a season, a time for every purpose under heaven. And just like a storm, this crisis or this season comes to pass. This crisis is part of this season. However, for our local African American community, we have been in crisis for years, and this pandemic is putting a spotlight on it. We are all aware of the recent coverage in the media that the African American community has been disproportionately impacted by this virus. And of course, this comes from the Illinois state data, which specifically has cases more documented in Chicago rather than here. But as the old saying goes, what happens up there will eventually or has hit here. Now, we just don't know to what extent this is, which brings me to my first point, which is I've heard that there have been numerous individuals who have suspected that they have or either had been infected, including my oldest daughter, who were told to just go home, self-isolate, self-medicate, especially earlier in this process. It is clear that by the time the most serious symptoms are realized, individuals are very sick, and especially when there are underlying conditions such as diabetes, asthma, high blood pressure, or other autoimmune conditions such as sickle cell, lupus, MS, sarcoidosis, forgive me for my pronunciation, that are prevalent in the black community that can become a death sentence. I am imploring that our leadership in Peoria reach out and work with whoever they need to work with to advocate for a testing facility in 61603, 61604, or 61605 area as soon as possible. I have spoken directly to congressional representatives in Washington, D.C., telling them that we need testing facilities to get specific data as it relates to our community. Another concern I have is the need for PPE, such as hand sanitizers, masks, and gloves in the more impoverished area. There are those who must use public transportation to get to jobs, grocery stores, pharmacies, and to the banks, and they need to be protected. And from what I understand, that for every one person that may be infected, there's an opportunity or possibility that 30 more can be infected. And one of the most important concerns I have, long before social distancing, the African American community right here in Peoria has been economically distant, and this crisis further exacerbates that fact. The National Resource Network report that was given a few years ago told us that we were already at crisis level poverty in the African American community right here in Peoria. And so I'm saying the same kind of focus we are putting on the shelter-in-place order is the same kind of focus we need for the African American community. I also believe that we need an intentional communication mechanism to ensure that our African American business community receives the information on how to take advantage of the programs that are in the CARE Act, as well as the coming package that Congress is currently working on. Another concern I have is to assist those who qualify for unemployment but have no access to the internet. It is important that we not assume that people know what programs that they qualify for. Systematic problems of neglect and indifference has existed for far too long. And the Bible tells us that we are to take care of the least of these and to love our neighbors as we love ourselves. And the bottom line is we are only as strong as our weakest link. Finally, we need to continue to be prayerful and to continue to be prayerful and careful as we go through this crisis. And we can get through this, but we have to get through this together. Thank you. Any questions?
Yes, so you mentioned, wanting, local governments to, especially reach out to these communities. Kind of what vision would you have for that in an era where, you can't necessarily go door to door to, help someone who may not have internet access, things like that?
Well, of course, social media is a good way, which I'm sure there are some things that are already being done in that vein, as well as the news outlets such as yourself. But I'm speaking also to those in leadership position, the leadership of Peoria, to go to work with people that they may know in government, higher levels of government, so that we can get the testing of facilities, so that we can have a better idea exactly of what's going on, specifically here in Peoria, in those most prone to the effects of this virus.
So the McLean County testing site is available to anyone that fits their criteria. Are you saying for the communities and those zip codes, especially here, that getting to that location is where the inequality lies?
Well, it could be, but also people cannot get to McLean County, especially if they're in poverty that may not have transportation. They may have to ride public transportation. So if we had it locally here in the metropolitan area of Peoria, which is the biggest city in this county, it would make it much easier and more accessible for those who may be infected but just don't know it.
So you would envision something similar to that here in Peoria specifically, like that drive-through facility with 250 tests available a day or so?
Yes, or whatever the case may be. But the bottom line is we need to have the test here in Peoria, specifically in the areas that are least likely to have health care coverage. In the African American community, that has been a lack for a long time, though the Affordable Care Act tried to address that, but now it's being fought tooth and nail. So we need to make it more equitable for those here locally that don't have transportation to be able to have those tests, so that when they go back home or whatever the case may be, they will know, so that we won't infect others in our families. Thank you.
Thank you, Pastor Hightower. And I think the pastor brings up some excellent points, specifically about how increased testing. Right now, that McLean testing site is a federal asset, which is limited to only certain locations in our state. And so once we get more testing available, to be able to offer it here in our community, to understand, as the mayor spoke of, what our true impact of the virus is in our community. And I also like to thank Pastor Hightower also for focusing on making sure that PPE and other protective equipment is available to individuals that don't necessarily have the readily available resources. And so a great example of one of the ways that that information has been processed to help with the equity question is that CityLink has been given face masks and hand sanitizer, as well as increased disinfection materials, so that they can provide it to their passengers, as well as to clean their transportation vehicles to assist. Again, recognizing the fact that we want to make sure that this virus is an equal opportunity virus, and so that all individuals should have that highest level of health outcomes. The mayor spoke that we are now reaching 1 month in our stay at home, and I think a lot of people are still discussing the impact of it in terms of their own mental health. And so to talk a little bit more about that, as well as how Unity Place is really driving major changes in our community, I'd like to introduce Dr. Bender.
Good afternoon. Thank you, Monica, for your leadership during this very difficult time. I'd also like to thank Mayor Artis for his excellent leadership in guiding us through this crisis, and thank Pastor Hightower as well for his incredibly important message around the African American community. As we're all aware, the COVID-19 pandemic is having an unprecedented impact on the residents of the Tri-County area, our state of Illinois, and the country in many ways. Together, we are taking steps to navigate the situation by being innovative and adapting to the needed changes that have come from this crisis. Attending to the behavioral health needs in our community is the mission of Unity Place. Just 1 year ago today, Unity Place was formed by joining the collective strengths of Unity Point's behavioral health system, the Human Service Center, and Tazwood Center for Wellness. We want you to know that Unity Place and its staff stand ready to meet the behavioral health care needs of Central Illinois now more than ever. Unity Place provides mental wellness and psychiatric services for children, adolescents, adults, and seniors in both inpatient and outpatient settings. For adults with substance use disorders, we offer a full continuum of care, from withdrawal management to outpatient treatment, including medication-assisted options. Outpatient services are also available for adolescents, as well as treatment options for behavioral addiction, such as gambling and shopping. Today, I'm here to announce something that we're very proud of, which is the launch of our new Access Center, where individuals and families will be able to connect with the right care in the environment and convenient and safe ways, regardless of where they live in Central Illinois. The Access Center phone number is 1-888-311-0321. Again, 888-311-0321.
I'm sorry, can you repeat that one more time?
My pleasure. 888-311-0321.
Thank you.
My pleasure. This is also available and prominently displayed on our website at unityplace.org. In response to the COVID-19 crisis, telephone and virtual outpatient options are even more readily available now than ever before. This was something that Unity Place was sort of forced to greatly expand upon in a very short period of time. But what has come of this is an incredible asset within our community to offer telehealth therapy services to people who can't make it in, or to people who are having problems with transportation or are too far out to make it in. We are not only reinstating groups for mental health and substance use disorders that we had to cancel due to social distancing issues early on, but we're also creating new groups that will be available, that will be directly responsive to the anxieties and the mental health crises that this virus has caused and is causing. Finally, our emergency response teams continue to be available to respond to mental health crisis situations. Peoria County residents can call 671-8084. That's 671-8084. And Tazewell and Woodford County residents can call 347-1148. 347-1148. And finally, calls to emergency response systems, local police, crisis centers across the country have risen as high as 900% in the last few months, directly related to COVID-19. We're seeing increased levels of domestic violence, increased levels of depression, anxiety disorders, trauma. We're seeing increased levels of child abuse. We're seeing increased levels of alcohol sales. And these things are likely to get worse and to extend for years past the coronavirus epidemic. Not only are we going to have to work hard to help our citizens maintain mental health wellness now, but likely well into the future. I cannot stress enough how important self-care is at this time, how you can do that when you're stuck in your house. Get more exercise or get some exercise. Try to eat right. Try to stay healthy. Try to get regular sleep when you can, and try to maintain some semblance of normalcy. If there was ever a time for self-care, it's now, because it can help quite a bit and be very effective. I'll take a few questions if there are any.
So when I call the Access Center for Help, who am I actually talking to? Am I talking to a licensed therapist, a doctor? Who's assisting me?
We created the Access Center with call center attendants who are trained to take the information and get you to the right referral or right resource for treatment.
And what can they assist me with specifically if I have a substance abuse disorder, a gambling addiction? You said transportation, even if I have transportation needs.
Yes.
What's the full gamut of things that I can call for help with there?
The greatest thing about Unity Place is that we are a very large organization and we have all of these resources under one umbrella now. So we have the ability to treat the patient who needs immediate inpatient services, from the patient who has a gambling disorder, from the patient who needs telehealth services because they can't get transportation. The Access Center is designed to triage the current needs of the potential patient and get them to the right place as quickly as possible without any delays.
But this would be different than a crisis center?
Yes, thank you for asking that question. We have our emergency crisis center numbers, which I read earlier, if there's an immediate mental health crisis. But if you're looking for services or new services or just information, or family members need information about services, this number will be great for that.
So you mentioned that you guys were starting up some groups that had been canceled kind of when this all started, especially when you're looking at a lot of, addiction groups, being anonymous is kind of, I think, really important for some people. So how are you still trying to maintain that while still getting them kind of that group support that sometimes people need to get through a crisis?
An excellent question. And one thing I'd like to clarify, the difference between like an AA or an NA group, Alcoholics Anonymous is in the title, and a behavioral health therapy type group is if we didn't have the current epidemic going on, these people would all be in the same room in a treatment facility. We're offering now these groups, again, kind of in a virtual environment. And the group members still do need to maintain confidentiality, and usually it's on a first-name basis. But it's a little bit different than, like, say, an AA or an NA meeting.
Do you think that this pandemic is changing the future of some forms of help like more telecommunication for help?
I do. I think that if you look kind of nationwide, many different areas of business are getting into this kind of remote distance working. I think that will persist long after. I can tell you for Unity Place, this is something that we had in the cards anyway, but we have rapidly deployed and advanced this technology much, much faster than I would have. But again, I look at that as an opportunity. We're growing a kind of a program within the company that's going to be a vast and incredible resource in the future. And like I said, if you look back to the SARS epidemic or epidemics of the past, there's clear evidence that mental health was significantly impacted not only during, but for years afterwards, and this is much more intense.
So how do you begin preparing for that now? Anticipate there is going to be mental health issues to address for years to come after this?
That's a good question. And also with our telehealth abilities, I think that's one part of the answer to your question. But as I look and try to kind of predict what kind of mental health crises we're going to be facing in the future, what I'm seeing is a tremendous amount of grief. We're all grieving the loss of normalcy and the destruction of our sense of safety. That has a tremendous toll on all of us. I see also a strong trauma impact from this. People with existing mental health conditions such as anxiety and depression are already experiencing an exacerbation of symptoms now, and that's likely to continue. So in my mind, I'm thinking about grief, trauma, and exacerbation of symptoms such as anxiety and depression as being the most prominent. Thank you all very much.
Thank you, Dr. Bender. I'll open up for questions.
Monica, when the pastor was speaking, he gave a pretty drastic number that he said he had heard, saying that for every one confirmed, there could be 30 that have it. We haven't necessarily heard that number from you. Can you kind of in detail say what those actual numbers are?
So Pastor Hightower was speaking in terms, I think, broadly on the fact that an individual that is infected, when they are asymptomatic and symptomatic, are very much have the ability to transmit the virus to other individuals. Original studies from Wuhan, China really had it as a 1-to-2 ratio. So for every one individual, they were impacting 2 others. Recently, the Centers for Disease Control and Prevention's Emerging Infectious Disease came out with new data from Los Alamos that actually said numbers closer to 6. So one individual can impact 6 people, meaning that COVID-19 is a highly contagious virus. And that's why social distancing and all of these practices that we've been putting in place is really to keep that transmission slowing down. And I think there was really new data coming out from Chicago that you can actually visually see that bending of that curve, which shows that we're able to really decrease that transmission rate.
The pastor mentioned, the lobbying he's done to our members of Congress for testing sites, the one in McLean County, one in 61603, 60604, 61605. You had mentioned at one point, I think a couple weeks ago, that we had been on some type of application list for something along those lines, and I think one just went up in the Chicago area, like Markham. Has there been any update or progress on getting one of those closer here than Bloomington?
So the question being how soon or possibly where we are in the kind of waiting list for one of those expansive testing sites. I think every day more and more testing goes online, both for our public labs as well as our private labs. I also know that there are some federal assets coming to federal entities, whether it's university-based or federally qualified health centers. And so I think the future for us to get increased testing is very much on the horizon. But again, it's going to be focused in understanding right now we have limitations in terms of reagent and product. And so as that keeps growing, then we'll be able to expand our testing capabilities overall. The focus really now is understanding, I think the mayor said it well, which is that light at the end of the tunnel. When are we going to kind of be able to transition into a little bit more of our normalcy? And one of the key testing that we're going to be looking for is antibody testing, which is still very limited and still under research conditions throughout the country. And so without having that antibody testing available, regardless of the current testing for symptoms, we are really going to be kind of basing a lot of our knowledge on surveillance and just general capacity issues of our healthcare providers to understand where we sit in this response.
So when do we make that shift from we need to test you for symptoms with the swab to we need to, an antibiotic test, I believe, is a blood test, correct?
It is.
When do we shift from testing for symptoms to testing to see if you've already had it? I mean, when does that happen?
So the question is, when will we make the shift from testing, do we have the virus, to have we had the virus, really? And we need to have more antibody testing available. I think the key thing to recognize is that there is some national studies that are blindly testing people. And you can actually go on to the website of the National Institutes for Health to register yourself to actually be part of the study sample to see whether or not we've had enough community transmission to, again, make that relaxing of policies available. But until we have more antibody testing available, we're not at that point yet.
Monica, we get a number of people that reach out to us a day saying, oh, I heard there's an employee at this store. I heard an employee at another store, and they're saying, why aren't they required to tell the public? Isn't that a public health concern? If you could kind of, I guess, talk about, what are the regulations in terms of stores necessarily making that clear to, potential patrons, and then how that kind of lines up with, passing it on to other people in the community.
So the question being about if an individual is notified and their employer is notified of their illness, then how is that generally shared to the general public? And so it goes back to really the boots on the ground efforts, which is contact tracing. The staff at the health departments throughout the state are responsible for contacting individuals that have been tested positive or their family members, depending on what their health status is, and then reaching out to any individual, assessing their risk, so knowing how much time they spent with them, how close of proximity, all that information, and then based on that, monitoring them. Some individuals are very low risk, and it's just an understanding of, oh, you've been in contact, possibly. Others can live with each other or co-workers that are in a shared space that, again, would be required to self-quarantine and monitor their symptoms much more actively. But I think the key takeaway for the general public is to understand that it's in the community. It's not necessarily that one person that knows that they have been tested positive that is positive. It could be beside them that's never been tested positive but also has the virus. And so, again, focusing on the fact that we should treat everyone and ourselves as if we have the virus currently.
Monica, where are we as a Tri-County area on the curve? Are we still on the upscale? Are we close to hitting the bend? Where are we at right now?
So the question being where we are in terms of our curve locally. We only have a total of 65 cases to date. And so in terms of the data, it's very limited in what we do have. And that's why we're also monitoring our hospitals' capacity to see if they see any surges coming up. I would say right now, if you were to ask me this question 2 weeks ago, I would have been very nervous. Today, not risk-free, but feeling much more comfortable about where we are and the pace where we're at. We don't see huge spikes of growth, and a lot of the cases we're seeing are ones that we are actively investigating because of contact tracing. And so while there's still community transmission, And again, even after we've gone to the peak and we've cleared and restrictions have been relaxed, people are still going to get the virus. People are going to still die of the virus. But it's going to be, again, recognizing the fact that the true emergency, which is the capacity of our healthcare system, is within the control of our healthcare system so that they can keep providing that high level of care.
I have a question for either city manager or the mayor. Eeny, meeny, miny, moe.
Tell me what the question is outside the picture.
Alright, so last night, city council had a long discussion about the budget. And you guys did mention, staff reductions. Would any of those reductions possibly be first responders, such as, firefighters or police?
Frankly, it's too early to tell. That was the very first part of the discussion that we're going to have on how to fill this humongous hole that's been created by COVID. Obviously, all of our employees are essential, really. I mean, we're really thin, but if it came down to a decision that we had to make in the next week or so, it'd be very unlikely that it would be, the first responders on police and fire.
Mayor Artis, Pastor Hightower calling on city leadership to truly help the African American community here in Peoria, saying that looking to you guys to provide that assistance. What do you think the city of Peoria can do?
So the question relating to Pastor Hightower is what the city can do and what we have been doing. It's actively working to help get the message out, especially into the minority communities and to the different demographics that may not use this medium that we're in right now as their traditional source of information. So that's what we're really doing, is trying to help get that information out to those people that might not really know this or understand the brevity of the situation.
Mayor, so the city of Pekin today rolled out a small business assistance grant fund, $1 million of CDBG funding. I know the city of Peoria has talked about something similar. Where are we in terms of getting similar grant assistance for small businesses here in Peoria?
So the question is Pekin instituted a small business plan to help them, the small businesses, get out of this situation. The city is in a position where we are getting extra grant money from the feds for CDBG, and we are exploring different options that we can use to leverage that money the best to help those businesses out.
Is there a timeline for when that money might start to be distributed?
I don't know if we have a timeline on when those checks are actually going to come out, but like everything else, it's probably not going to come out as quick as everybody thinks it's going to, just because of the number of cities that are waiting for it.
If there's no other questions, we will see you guys tomorrow for the briefing. Thank you again.